Good morning, everyone. Well, it's great to see so many people who are joining the session this morning. I think in the last two sessions from last Wednesday to today, we've had over 200 participants, which is fantastic. So, as I say, good morning, and I hope you're all well and had a good weekend. And the first one, which many of us would have seen loved ones and family for the first time in over the last 3 months, with some easing of lockdown. And we just continue that those measures continue to ease over the coming weeks. For those of you who don't know me, I'm Carl Paget, Head of Underwriting Claims for the Europe Business Unit here at Pacific Life Re. I'm delighted to welcome you all to our second webinar in our series focused on access to insurance. As Marla mentioned last week, these webinars are replacing our annual seminar, which was due to take place in London this month. Unfortunately, due to COVID-19, we've had to place alternative arrangements in place. We have a variety of speakers covering various topics, and last Wednesday, we had Mike Adams, CEO at Purple, present our first webinar in our series of 5. So today, I'd like to introduce Joanna Scott. Jo is Policy Advisor in the Health and Protection team at the ABI and began her career as a Policy Assistant in the Conduct Regulation team. The ABI Health and Protection team have been working with member companies and charitable organisations to develop an industry and consumer-focused initiative to improve how our sector serves consumers with mental health conditions. In this session, Jo will be giving an update on this work and the best practice guidance for insurance as part of the mental health and insurance standards. Jo will also be discussing the work the ABI have been doing in partnership with all ABI members to support customers with COVID-19 claims. Please ensure you keep yourselves on mute throughout the presentation, and if you have any questions, please use the Slido link that's in the diary invite to submit any questions you may have for Jo, and we'll be running a Q&A session after Jo's session. We're recording today's session, so please feel free to turn off your video, and we'll be sending a recording of the link and a link to a feedback survey either later today or tomorrow morning. So without further ado, and I'm going to say I can see numbers increase even more, I'll let you hand over to Jo for today's session. Thanks, Jo.
Thanks, Carl. So as Carl just mentioned, I'm going to talk today briefly about the work that we've been doing at the ABI with members on mental health and access to insurance, and then open up to a few questions. So first of all, I'll touch on some of our COVID-19 protection priorities that Carl also mentioned, and then look at insurance standards that we've been developing and a few other related work streams, like an advisor and frontline staff training module and a customer website developing in collaboration with Mental Health UK. So firstly, a bit about what the ABI does, which I'm sure most of you are already aware. And then, so as many of you can probably imagine, much of our work over the past few months has been quite dominated by the coronavirus. And within this, we've worked with our members to publish commitments both on protecting existing customers that claim and also on underwriting commitments to demonstrate that industry is continuing to offer where possible without delay for the majority of customers. And both of these commitments were kind of circulated, were centered around supporting the NHS and being mindful of the NHS priorities. So members were committing to access evidence, mostly from customers and alternative methods of sources of evidence rather than supporting placing additional pressure on the NHS. And also action on life income protection and hospitalisation cash benefit claims, and they're collecting case studies to support around the industry's response to COVID-19. And I think access to mental health support is a great asset in protection policies at a time like this. So I'll take you through the process of how we developed the mental health and insurance standards. So in mid, the ABI identified that policy work was quite crossing and across health protection and travel insurance policy. So our health protection and travel committees discussed the potential reputational risks, specifically related to access challenges for individuals with mental health conditions, and then held an event in January 2019 with the Royal College of Psychiatrists and other mental health campaigners to identify some of the key access issues and kind of think up some solutions to these. This also followed several stories in the media around customers with pre-existing mental health conditions facing challenges when accessing insurance. So here are a few headlines at the time. And this also came at a time when key industry stakeholders, former FCA Chief Exec Andrew Bailey and some senior politicians were taking a keen interest in the matter. So from the areas that came under the most scrutiny in the sector were the screening process, in use of outdated evidence or the perception of that, and barriers in the customer journey around disclosure of mental health conditions, and also communications around loadings and exclusions. A few of the other things that came up were a kind of perceived lack of empathy in the application process, and also more recently, I've seen a survey from Mental Health UK that had some interesting statistics on this. So they found that 60% of people felt that they weren't adequately warned that the questions in the application process of insurance could cause them distress, and 40% of people felt that the questions asked were insensitive, and 60% of people weren't really aware of how their answers would inform the insurance, and almost 50% of people felt distressed after the application process. So it's clear back in 2019 and still now that there's a lot of stigma around mental health, including customers' perceptions of the industry, and a bit of a mismatch between what was occurring in the industry with acceptance rates and what customers thought about the industry, especially the perception that they might not be able to get cover if they disclose a mental health condition, and the insurers make a lot of generalized assumptions and just kind of a general lack of understanding on the writing process works on the whole. So following this event, the ABI board in January 2019 identified that developing an industry position on mental health was a key priority work stream for the ABI, and so the next February, the ABI mental health working group, of which Carl is a part of, to develop industry proposals following the feedback from the Royal College of Psychiatrists workshop. And the first proposal by the working group was to provide clear guidance to health protection travel insurers and reinsurers in supporting the needs of individuals with prior or existing mental health conditions when they seek insurance cover. And this takes the form of the mental health and insurance standards. And other themes that identified were by the group and by the workshop were the need for, we're taking that forward with the advisor and frontline staff, and then also the customer perception aspect. And so we're taking that forward with the website with Mental Health UK to give customers a bit more information about insurance and the process. So now onto the standards themselves. The standards have 4 key commitments supported by concrete and measurable actions. And as you can see, they span from kind of improving accessibility and communications channels, and then on the application process itself with the questions, and then communicating decisions and cover and transparency, which focuses around the evidence used in underwriting decisions and letting customers know that they can ask for more information about that, just kind of raising awareness of those aspects. So to drive consistency across the industry, as well as continue to raise the bar with some best practice. And they're also an opportunity to highlight the role of insurance products in providing support services to customers with their mental health conditions. And the aim was to keep them quite high level so that they could be tailored to each company's own underwriting proposition, and make them a bit more kind of personalized to each company. And alongside the standards, we'll also publish a question and answer section, which provides more detail on and a bit of information for customers. So I think it's important to note also that the standards aren't a condition of ABI membership, and they only apply to underwrite individuals and also the reinsurers who work with those companies. However, all members with the relevant product lines are encouraged to implement and demonstrate kind of industry commitment to and proactive change in the industry for individuals with mental health conditions. And also members or other ABI non-members and reinsurers signing up are expected to have completed implementation of the standards by no later than the 31st of December 2021, working and continue to work with the mental health working group throughout implementation and monitoring progress on this. So, as mentioned a bit previously, to complement the standards, we're also a customer-facing mental health and insurance website hub in partnership with Mental Health UK. And we went with Mental Health UK mainly because they operate across Scotland, England, and Wales. And I think that was a key position for us, that we wanted to be accessible to everyone in the UK and Northern Ireland. And this will sit on their mental health and money advice site, which is a kind of independent site which mainly focuses on helping customers learn a bit more about financial services, but it mainly focuses on debt support at the moment. So we thought having an insurance hub would be a really, really good addition. To be a one-stop shop about mental health and insurance, and provides a guide to insurance policies for people with mental health conditions, and it's recognised as it's mental health friendly, and it's tested by people with mental health conditions. And it can also, there's also going to be a page for signposting to the relevant support services or advisors. And this aspect was primarily aimed to demystify some of the perceptions of the insurance industry and the perception that you can't get cover, which was an important aspect for this work. Also working with the charity Right Steps on an advisor and frontline staff training module. And we had a workshop a few weeks ago with members and advisors and the CI to kick off the development of this, which aims to be a sort of industry benchmark for training on mental health, and this is still in progress. So we'd originally aimed to launch the standards and website at an event in April, but this was kind of cancelled, obviously, due to coronavirus. So we're looking to host a webinar in late September, which should be going live soon. So I'd recommend anyone to sign up if you'd like, and we can circulate the link to this. And I'm sure we can share that with Carl and the team if you want to hear more about the standards. So I will open it up to questions now.
Thanks, Joe. I know there's a huge amount of work that's been going on across collaboration across industries, and as Joe mentioned, including the protection, the health industry, and also motor. And it's been no mean feat, that's for sure. And I can see there's some questions been coming through on Slido, which is fantastic. So please keep those coming through, because we have 15 minutes to go through to 11:30. So okay, one of the questions that's come through, Joe, is: are reinsurers sufficiently bought into this process? Application form questioning is centered around the features cited in reinsurance manuals to categorise risk.
I can answer this as well as probably you, Carl. Yes, reinsurers, and they were represented in the working group. And as Carl probably knows, we use them as like a big resource in developing the standards, and they were consulted throughout the process. And the main aspects that apply to reinsurers were with the obviously with the evidence and reinsurance manuals. So the responsibility for those actions is both with the direct office and the reinsurer. So we're kind of wanting to have definitely a link between the two, and shared responsibility and accountability for those actions. But yes, definitely the reinsurers were involved in the process.
Just to add to that, obviously I'm part of the working group, as are other representatives from other reinsurers and from other life as well. So obviously there's a key part for us, and obviously if for those who will have seen or aware of the protection platform and the journey that comes through there, and those insurers that do have business going through the protection platform, there's a huge amount of work completed in respect to mental health, and application form questions were updated earlier this year to actually really personalise the journey more for customers who've had sort of a mental health condition. And in my session at the beginning of July, I'll be adding further details around that, and also the impact that we've seen in terms of disclosure rates as well. And I do know that some insurers have actually adopted a similar approach to that. And as Mike Adams said last week in his session, we really need to make sure that our application form questions are fit for purpose. And it's really something that, say, reinsurers and insurers should continue to do, is to look at how we do word our questions, because I think one thing, well, I've learned a lot through this, is actually the way we may interpret questions could be very different to that of our consumers as well. So it's an important part of the overall process that we play that part in as well. So thanks for that question. I can see a question's come through as well from Martin Duffy. Joe's mentioned signposts with sensitive questions. Can you give us some examples of best in class?
Or signposting what services? I think that's quite an interesting, because we were obviously working across health protection and travel insurance. So signposting was quite a tricky one, right? Which is why we've kept it quite high level for providers to have their own approach. Because, for example, with a travel insurance policy, if you might have multiple disclosures, so only signposting for mental health services might be and it might be quite irrelevant to signpost for that if the biggest disclosure is something like diabetes. So I think we'll still be kind of working through with mental health working group as time goes on to know exactly what that best practice looks like and what's kind of most impactful for people. And I think that's what's really helped with doing the website with Mental Health UK, because they've conducted a survey towards the end of last year that they'll be publishing quite soon, is with I think it was a couple of thousand insurance customers, and to kind of know from surveys like that what customers really want to see and what they will find useful. But I think even for insurers to signpost to customers to the website might even be a really useful resource, because then it gives a kind of more impartial overview of the industry and the whole process.
Yeah, just for that, thanks, Joe. I'd also add that if any sort of insight into signposting questions, more than happy to discuss that further as well outside this session. As I mentioned, around the work that we've been performing in conjunction with Underwrite Me around the application form journey, and in particular sort of around a customer's mental health versus their physical health. I think if you look at traditional application forms, they're structured of have you ever, and there's a list, a whole list where you may see heart disease, cancer, stroke, then you may have, say, severe depression, schizophrenia, admitted to a psychiatric hospital, suicide attempt, and then you have HIV, hepatitis. And so as a consumer, I think we need to start to think about putting ourselves in the consumer more as they read through those questions. But as I said, more than happy to answer those questions outside of this session. Well, we've got a few more questions coming through from Slido as well. If there's one takeaway that insurers can look to implement to help those with better mental health conditions, what would it be?
Yeah, a really good question. I think that ties into what you just said, Carl, about looking at the application form from a customer's point of view. And something that came out when we were talking with the working group was, while we all might think the questions are quite self-explanatory and kind of make sense distance together, it's also good to share the question forms or the application forms, not even necessarily outside the company, but just to other people within your own company, like medical directors, just so you get a second opinion on how these kinds of things read to someone who might be a bit more sensitive to a question about suicide, for example, if there's been no explanation prior to that. And I think something that we've drawn out in the standards as well is just kind of justifying what the information will be used for, because people might not have as much trust in the insurance industry of why that information is needed or what it's used for, and there's no direct link to them between the answer of the question and the end result. But I think it's quite hard to strike a balance between overloading customers with information while also explaining why certain questions are asked and being a bit more sensitive in the way that those questions are asked.
Yeah, as I say, from an underwriting perspective, underwriting mental health is a real challenge. You know, there's lots of subjectivity. Everyone has their own story, and it's very different to actually underwriting, say, a diabetic case where you have clear risk parameters in terms of their diabetic control, what if they've got any complications, how long the condition was diagnosed ago. But then when you look at mental health, it is very subjective in a lot of areas, and it's great to see so much work being done in this area, and seeing different companies taking different views and the way they can underwrite it in terms of understanding those people's stories. And I think that's an important part as we look to consider more cover for people who have a past mental health condition or actually on current treatment. And I think, say, when you look at sort of your own straight through process rates, a very high percentage of people who disclose a mild mental health condition will be receiving cover through those rules, which is fantastic. And I think that's been the evolution since I started underwriting to where we are now with expert rules. Sometimes they're for the great. I think there's some cases that where you don't actually, unfortunately, don't hear the voice from the customer as much as you may do, as we would have done back in the day.
Yeah, and I think just to add on that as well, a point that came out with the charities was that people didn't feel like they had the opportunity to tell more about their story and the condition. There's no kind of simple answer to that, and it's obviously trying to strike a balance. But there's definitely, I think, mental health a lot more nuanced than, say, disclosing something to do with your physical health. So I think it's just striking that balance.
Sure. Thanks, Joe. Okay, we've got a few more questions coming through from Slido, which is fantastic. Have you seen an increase in mental health disclosures since COVID-19 started? So perhaps, I mean, as well as disclosures around questions to the ABI around mental health and support they can get from insurers?
Definitely, I think is obviously a topic of conversation, especially at the moment during this, because there's been rumours of a kind of health crisis looming. And I think we've definitely tried to highlight the role that insurance can play in supporting people's mental health, especially in kind of access to these services that you won't wait for NHS waiting lists, which, as everyone knows, after this are kind of obscene. You'll have to wait such a long time to get these kinds of appointments, even before COVID-19 happened. And so when we're collecting the claims data and the case studies, mental health, I think, is also just something that people relate to a lot more, and think that I think they value these services a lot more, especially in the media and things like that. So definitely, I think it will also include questions around that. And in terms of actual mental health data, we'll have a bit more information about that once the data collection comes back, but we'll be using that to inform our narrative with the.
Great, thank you. So 5 minutes left on time, but we've still got a few questions to go through. There's probably an overlap on this question to what we discussed a short while ago around application form questions, but questions come in. Resilience is such a key feature in mental health and mental illness. What work has been done on developing questions around this for underwriting purposes? I might kick off on that. I mean, it's something episode Life 3 that we've been looking at a lot in terms of resilience and talking to our CMOs around that. And the biggest challenge actually understanding someone's resilience compared to another person, because they're very different. And also, if you're using a scoring system, what is actually their score on a particular given day? So it's something that we'll look to continue to investigate. And I know that there's a lot of good work done by a lot of other insurers around this space, especially where you can actually perhaps utilize tele-interviewing, perhaps in respect to income protection, to understand the person, say, resilience in terms of performing their occupation, their time off work, what their pursuits are outside of their job, and also just around the management of their condition. So I think that as time evolves and we really look to understand each individual person, I'm sure we'll see more of that.
Yeah, definitely. I agree with all of that. And it's just kind of what I've mentioned before, just making sure that you share application questions more widely than an underwriting team, because even just having a different perspective from within your own company can really help. And they might identify areas that might be a bit more sensitive than others. But it's definitely something if we can look into more with the mental health working group. But I'm sure within insurers and reinsurers is there as well.
Yeah, certainly a space show. There's a lot of work going on, and we'll continue to work on it and evolve as well. I'm sure once the standards come out as well, again, it's something, say, insurers or reinsurers will look at even closer. So, I think this is it's not the start, because there's been a lot of work going on beforehand, but this will really drive momentum and all in the right direction. Okay, we've got a few minutes left, so we can take a few questions. See, there's another couple on slide 8. With all the work that the ABI performed in respect of mental health, will they be working with other charity groups and other conditions in the future?
Yeah, I think this is a really interesting question, because it's come up quite a lot just in our advocacy work while developing the standards as well. Why not other conditions? It's not a question of why mental health has kind of been picked out and that other conditions won't be looked at in the future. It's just that at the time that we had looked into this, mental health, the way that mental health was kind of dealt with, did appear slightly different to other health conditions, in particular around the evidence used and the kind of sensitivities of the questions and the impact of those. So I think it was brought by the campaigners, and so definitely we're always open to applying the same rationale that we've worked with on this to other conditions, and it's something we'll look at over the next year, I think, especially if people if kind of these issues arise with other conditions.
Yeah, I think from my perspective, Joe, sitting across different working groups, it's clear there's going to be sort of a challenge in other areas. And I think it's actually giving clarity for underwriting of what we do and how we do it across the spectrum, not just in respect to mental health, because I think that the principle does apply for all. So again, it's work that's going to continue, and the right thing that we should be doing as well.
Yeah, definitely. And I agree, Carl. Throughout the process of developing the standards, all the members of the group were really adamant that you shouldn't treat mental health differently to other conditions. It's kind of raising the bar for all of them, and the standards can be applied elsewhere. That was a really important part of the work.
Yeah, definitely. So you've got a couple of minutes. One last question that's come through on Slido was, drill down questions of mental health has evolved to layer in language from claims misrepresentation. Is the criticism of questions too clinical based without appreciating this rationale? And this perhaps does touch on something we spoke around, I know, putting yourselves in the shoes of the customer and actually thinking about the language that we do use. I think it's very easy for reinsurers and insurers to use technical language around sort of medical phrases, medical conditions, but do our consumers actually understand that? It's actually very interesting at the weekend. I don't know if you saw this as well, coming through on Facebook and other social media, lots of adverts coming through for life insurance at the moment. I don't know if anyone else has seen that. One question was from a person was actually, I have some life insurance and critical illness, can I buy some more? And I think that actually does show perhaps the lack of insight or knowledge that our consumers and potential consumers do have around our protection products, which are so valuable at this time. And obviously at any time, but it's obviously highlighting it through this pandemic. But it does show that the education that really needs to continue and really explain what we do and why we do that.
Yeah, definitely. I very much agree with that. And I think that's where the website will come in as a really helpful, and this kind of reiterating the point to customers that answering the questions very truthfully is really important, and that it's having a bit more trust between the customer and the insurer of how that information is going to be used, and that they can request certain information back and have a bit more clarity of the underwriting process on the whole.
Thanks, Joe. Now, that was the last question that came through in Slido. And unless you've got any other questions, so I'd like to draw the session to a close. What I would like to say is thanks, Joe, for taking the time out today to provide a really interesting insight into all the work that the ABI have been doing, which is fantastic to see against industry collaboration. I'd like to thank you all for joining us today as well, and all your questions as well, which made up this session. And also I'd like to highlight as well that our next webinar session is on 24th of June, and we'd love to see you all for that session as well. So if you do have any other questions that you'd like to raise with either Joe or myself, please do drop us a line outside of the session. And hopefully you have a good rest of the day, and look forward to seeing you all again soon. Take care. Thank you. Bye-bye.